worries. No worries.
Okay, got it.
All right, perfect. So this is going to be recorded onto my computer. Just for clarification, we will have some people joining us live and also on video, but the recording is going to be specifically for the study of pathophysiology for the advanced EMT. So I'm going to go ahead and share my screen. This is some papers from the workbook. So we're going to go over for medical terminology purposes, and also it'll roll into patho, right? So if we're talking about something specific, let's just go through our words, right? So let's hit our words really quick. So edema is what? Swelling, right? Swelling.
Yeah.
Yeah, specifically, what does swelling mean? What is edema? That word actually means swelling, right? But what is swelling? Fluid where it isn't supposed to be, right? Fluid in an interstitial space. So what's interstitial? The in-between parts, right? So fluid should be in the vascular system only, right? We have some minimal lubrication around our organs, around other stuff, right? But fluid should only be in the vascular system, in the vessels. So when those vessels get leaky, those capillaries leak, they become more permeable. Then we have swelling, which is another word for edema, and it's because of that increased capillary permeability, okay? So perfusion is literally the act of oxygenation of the cells, right? So we're getting oxygen to the cells, we're pulling carbon dioxide out of those cells, and the act of actually exchanging gases is perfusion. And this is on a cellular level, okay? Chemotaxins, I don't know what that is. We're going to go through that one. Haptin, again, another one that I'm not sure about. So we're going to learn that one together. Immunodeficiency. So if we look at this, immuno has to do with our immune system, right? Deficiency meaning we don't have enough of it. So anything that causes an immunodeficiency, such as an autoimmune disease, would be part of our immunodeficiency, okay? Atopic, it typically means it's not something is not there, all right? Hemophilia, we know that this is going to be related to blood because of the hema portion of it, right? Philia typically means lack of. So hemolytic anemia, hemolytic is literally where the blood cells themselves are destroyed or lysed. So anything lytic means to cut. So hemo meaning blood, cutting, and then anemia. Emia is blood, right? EMIA. So lack of blood. So we have a lack of red blood cells actually in this one, right? Polyuria, poly means many, poly means a lot. So we may have a lot of something. In this case, we have a lot of urine. We are peeing too much, right? Obesity is a word all by itself. It simply means that we have too much mass, right? Specifically too much adipose tissue. Atrophy, this one is one of those medical terminology words where A meaning without, take away, none, right? Trophy relates to the muscles and how they work. So atrophy would literally mean lack of muscle strength, lack of muscle density, lack of muscle size. So if we think of like muscular dystrophy, right? The muscles don't work very well. It's actually a nervous disorder, right? But atrophy is literally the wasting away of muscle tissue. Pathophysiology, the study of disease processes in the physiological part of the body, right? Anatomy is a study of the structure. Physiology is a study of the function. So when we add patho in front of it, now it becomes a study of the function of the body with disease. Hyperplasia, I know this word and I absolutely cannot remember what it stands for. I want to say that it's difficulty walking, but we're going to look at it. Dysplasia, metaplasia, we're going to do all three of those. Acidosis, alkalosis, the bane of my existence, right? These are acid and base, right? So we're going to do some ABGs later. Hyperkalemia. So K is potassium. It's the what's it called? The table of the elements, right? For potassium. Hyperkalemia is too much potassium in the blood. So we have the emia, which is blood, right? Hyper meaning too much. And then the K is potassium. It's not the same as vitamin K, okay? Oliguria, again, that means too much P, but okay. Hyponatremia, let's break that one down, right? Hypo meaning too low, right? Na is the elemental name for sodium. Na, that's actually a positive, but Na is sodium, and then tremia meaning blood, right? Free radicals are why you get wrinkles. Virulence refers to how potent something is. So if we have a really virulent strain of flu, it means that it is really strong, right? And it can be infecting multiple people. Pyrogens. Pyro typically means fire or heat. So something that would cause an increase in temperature. Apoptosis. Oh, should have read all these words before I started this, right? It literally means cells, and it's the destruction of the cells, but it is bursting of cells. So the cells get too full of fluid and then they pop, right? Literally. Allergen is anything that we can be allergic to, something that would cause an immunoreaction, all right? Oops. Margination is literally to encapsulate something. Activation meaning to make it begin. Adhesion is when something sticks together. So we might have an adhesion from like scar tissue. Somebody ever tells you, oh, you have a lot of scar tissue in that area. Well, it's because we've developed those adhesions, which makes that skin or that muscle a little thicker and it makes it more difficult to move, right? Transmigration and diapetesis. That one, I don't know. We're going to figure that one out. Chemotaxis. Polymorphonuclear neutrophils. Ooh, very exciting. Neutrophils are white blood cells. All right. Poly meaning many, morph meaning shape, and the nuclear usually means one, like the nucleus, but we'll find out. Cytokines are blood cells, and then interleukins, again, white blood cells. Interferon is a medication used for lots of things, actually. And then lymphokines, again, more blood cells, all right? So instead of reading every single one of these, let's just go through and look at the answers, right? All right. So number one is going to be G. All right. So we're looking at edema. And what did we say it was? Swelling caused by excessive fluid trapped in body tissues. So we are correct, right? Swelling literally is just plasma, typically fluid, trapped in the interstitial spaces, trapped inside that body tissue, right? So what did we say perfusion was? Perfusion is going to be S. Oxygenation, right? This is actually gas exchange at the cellular level. So if we're looking at the letter S, the delivery of oxygen and nutrients and removal of waste from the cells, gas exchange at the cellular level, right? Chemotaxins, it says the answer is L. So chemotaxins attract leukocytes from the circulation to help fight infection. So a chemotaxin is going to be something that is a blood cell or a typically type of cell that's going to be activated to say, whoa, 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 we didn't like this. So we're going to grab white blood cells and we're going to bring it to fight whatever it is that we're doing, right? A bacterial or a viral infection. Hapten, it says is Y. Let's scroll it down and look at Y. What do we see as Y? A substance that normally does not stimulate an immune response, but can combine with an antigen and later initiate an antibody response. Ooh, interesting. So if we're thinking about a hapten, and I hope I'm pronouncing that correctly, I've not seen that word before, and I've been at EMS for a very long time. So a hapten could be milk, right? It could be, I'm trying to think of something else. It could be peanuts. It could be something that does not normally stimulate an immune response, right? I can eat peanut butter all day long. Nothing bad will happen to me, right? But if someone has this particular substance, a hapten in their body that says, nope, we didn't like peanut butter, then it will literally trigger that immune response, all right? Immunodeficiency, number 5, the letter is going to be U. So an abnormal condition in which some parts of the body's immune system is inadequate. So a very, very easy to remember one is human immunodeficiency virus. So HIV came around in like the 80s and 90s, and it was like, oh my gosh, everybody's going to die of HIV. Turns out it's really not a very virulent virus, right? It's pretty easy to kill. Put it at room temperature in the air for more than 30 minutes and you have no more HIV. So HIV affects the entire body system. So HIV is a human immunodeficiency virus that causes your immune system to not function properly. There are tons of immunodeficiency diseases, rheumatoid arthritis, there's lupus, there's tons of other things, right? But they all affect the immune system differently, all right? So number 6 is atopic, and that letter is going to be I. So an allergic tendency. Ooh, I did not remember that one. Atopic is an allergic tendency. So we're just going to have to memorize that one. So maybe it's the tendency like, hey, my body just does not react well to this. All right. Hemolytic anemia was next for number 8. Hold on a second.
7.
Hemophilia is number 7. Sorry about that. And that is O. Hemophilia is an inherited disorder characterized by what? Excessive bleeding. So hemophilia, literally blood and then bleeding, right? So excessive bleeding, typically in males. Males are much more likely to be hemophiliac.
That's an American.
So no, so hemophilia is actually more of a white disease. Yeah.
So
So sickle cell disease, and it's not necessarily African American, it's actually African. So sickle cell is the African continent. So
Okay.
depending on whether you're white or black, you can still have tendencies towards sickle cell.
hemophilia means they can't clot, correct?
Yeah, they're missing at least 2 clotting factors, actually. Yeah. So they literally, the clotting cascade is like 17 different sections, and they're missing like 2 to 4 of those with hemophilia. So people can be missing 1 or 2, like von Willebrand's, and they clot later. But then hemophilia is truly like that clot cascade is totally messed up. Yeah. And they just don't clot. Yeah, there's a big joke in EMS that it was a busload of hemophiliac nuns, and it's like, because all the problems, right? It's like, yeah. All right, so now we go to hemolytic anemia. So hemolytic anemia number 8 is A. Let's scroll it back up and look here. Yep. So characterized by increased destruction of red blood cells. So remember what we talked about a while ago? Hemo, red, right? Red blood cells typically. Lytic, meaning to lyse, to cut. And then anemia, a lack of blood cells. So anemia is a lack of blood cells in general. Hemolytic is literally the destruction of red blood cells. Something is causing our red blood cells to die. Something is lysing them, is cutting them. Polyuria is M. So if we're looking at M, frequent urination, poly meaning many, urea meaning to pee, lots of urination. All right. Obesity, we should already have gotten that one. Q, an unhealthy accumulation of body fat. So why is that word unhealthy in there? Should you have some body fat?
Some.
Yeah, we need body fat, right? We need it for nutrition. We need it for temperature control. We need it for thyroid. Like you should have some fat on your body, right? It just shouldn't be 50% fat. All right, number 11 is atrophy, and that corresponds to letter D, a decrease in cell size due to a loss of subcellular components. Holy cow, man, that's just when like your muscles like shrivel up, okay? Like typically muscles, but it is muscles, I guess, are made up of cells. So a decrease in cell size due to loss of subcellular components. So to atrophy, you can also make a cell atrophy if we are using like a hypertonic solution. It can cause that cell to shrivel up. So you can see where they're going with that. 12, pathophysiology corresponds to C, the study of the physiology of altered functioning in the presence of what? Disease. All right. So disease processes will cause different areas of the body, right, to function differently. 13 was hyperplasia. Let's look at V. So this one is V. Let me scroll it down a bit so we can read it. Hyperplasia is an increase in the actual number of cells in an organ or tissue. Interesting. Okay. So clearly this is not something I've had to deal with in my EMS career. So an increase in the actual number of cells in an organ or tissue. So we have a proliferation of cells, which might cause that tissue to become more dense and perhaps not able to function as well, right? So dysplasia is going to be something similar to that. And it is T, an alteration of the size, shape, and organization of cells. So something with dysplasia, I'm going to be willing to bet that metaplasia is going to correspond to cancer of the cell. Let's see. So this one's B, refers to the reversible cellular adaptation in which one adult cell type is replaced by another adult cell type. So any of our plasias are dealing with cells, too many cells, our function of our cells is wrong, and now we have our cells are being replaced by another cell type. So this could very specifically be like when a tumor grows, right? That tumor is replacing what that cell was meant to do, and now we have a tumor instead, a cancerous cell. It may not necessarily be that. It could also just be the pigmentation of your skin. Maybe that mole is getting bigger, but it's benign, but it would be more melanin in there, more, a bigger area. So all of that is doing with cells and what their job was, and now they're changing that job just a little bit. Acidosis is W, an increase in extracellular hydrogen ions. So extracellular meaning we have too much hydrogen outside the cell, all right? So this is when we get acidotic. So what do you think alkalosis is going to be? Alkalosis is going to be H. It's going to be a decrease in extracellular hydrogen ions. So extracellular meaning outside whatever cell it is, okay? And we need hydrogen no matter what, but we don't need it in excess or a decrease of it, okay? So 18, hyperkalemia, and it's going to correspond to E. And what is that? An elevated serum potassium level. What does that mean, serum? Serum is blood. So if we are, spinning down our blood, it actually has several components, right? I once drew blood from this guy and I didn't have to spin it. Like his cholesterol level was so high. It just became solid in the tube and had a little bit of plasma at the bottom. I'm like, wow, should not look like that. I'm like, I'm pretty sure your cholesterol is through the roof. It was actually, I couldn't even centrifuge this thing down. But serum is what, when we take out the red blood cells, the white blood cells, it's what we have left. All right. And that's too much potassium in the blood. Okay. Oliguria goes with X, and that is a decreased urine output. So oliguria would be not enough. I haven't seen this word since nursing school, so clearly we don't say that a lot. I would just say, hey man, he hasn't peed in a while, right? Decreased urine output. So oliguria could afflict someone with kidney disease, right? If your kidneys are not processing urine, you're not going to pee, are you? Like, is that normal for them? Yeah, that's why they're on dialysis, right? To clean those toxins out of their blood that can't be filtered through the kidneys. Number 20 is hyponatremia. So hypo meaning low, Na meaning sodium, emia meaning blood. Number 20 goes along with J, a serum sodium level of 135 milliequivalents per liter or less. So serum sodium level of less than 135. That 35 comes up a lot, doesn't it? CO2, 35 to 45, pH, 7.35 to 7.45, and now we have sodium, 135, right? And we need, our heart's a sodium potassium pump, right? We need that sodium potassium in the right spots, in the right quantities. Number 21, free radicals corresponds with K. The earliest and most dangerous mediators produced by cells in response to hypoxia. So free radicals literally go around and just start bombarding all of your healthy cells, right? Which is why you get wrinkles, why you get sun damage, all this stuff. They're like, oh, kill the free radicals. Yeah, it's just positively charged stuff. So if we stay oxygenated, we stay hydrated, we reduce our free radicals. 22, virulence corresponds to N, measures the disease-causing ability of a microorganism. What's a microorganism? Something too small to see, right? A virus, a bacteria. What is that?
Something impossible to see with the naked eye.
Yeah, exactly. Micro, meaning very, very small. We can't see it with the naked eye. And how virulent is it, right? How toxic is it? How potent is it? HIV turned out to be not very potent once it was given to air, right? Hep C, on the other hand, can last for several days, even dry. COVID, I think the story's still out with that one. All right, so 23, pyrogens, P, stimulate a rise in the body's core temperature. So a pyrogen is not necessarily something like pyrotechnics, all the flashing lights, right? But a pyrogen is something that your body does. So if I get a bacteria or a virus in my body and my body is like, whoa, we don't like that. What do I do? What's my body do in response to that? I get a fever, right? So the pyrogens in my body are activated to increase my body temperature. And then people are like, oh, no, lower your body temperature. No, this is good. Okay, my body needs that high temperature because viruses and bacteria thrive at normal body temperature, right? So my body stays 98.6. That bacteria is going to grow, right? So if my body just increases its temperature a little bit, we kill the bacteria and then everything goes back to normal, right? Can this backfire? Can something be so bad for me that my body's like, all right, we're going to raise our temperature super high? Yeah, that can absolutely happen, right? So our pyrogens have to work with our body, but we also have to allow our body to heal itself, right? But we don't want to go above 104. That's pretty high temperature, right? All right, so apoptosis 24 corresponds to the letter R, normal cell death. So apoptosis is literally when cells are dying, and typically they burst. So when a cell dies, the wall of the cell becomes thinner and they just dissolve, right? So it's literally like, it was a meme once where it showed like little cells like popping like crazy, right? And they just get filtered through your kidney, through your liver, and you just pee it out, right? Cells don't live very long. They have very, very short lifespan. Very short, like as in a matter of days or weeks, not like people. All right, allergen 25 is F. Any substance that causes a hypersensitivity reaction. So why not allergic? Why not use the word allergic reaction there, right? Because we're talking about pathophysiology, so it's hypersensitive. So, and that would be something that I might not be allergic to something, but someone else could be, right? So an allergic reaction is literally just a hypersensitivity to whatever that thing is. Let's scroll it down. Margination is HH. So let's scroll it down a bit to our next page. The loss of fluid from the blood vessel into the tissue, causing the blood left in the vessels to have increased viscosity. So interesting. I've not used this word before, but margination sounds a lot like edema, doesn't it? So that HH, where did it go? The loss of fluid from the blood vessels. So what's fluid? The plasma, right? The stuff that your blood is actually multiple components, right? So I have all those little cells, white blood cells, red blood cells, everything flowing in this plasma. So once that increased permeability happens with my capillaries and the plasma leaks out, my blood gets a little thicker, doesn't it? And it's more likely to coagulate, more likely to clot. So a higher viscosity is not good for the human body. We don't want our blood to be very, very viscous, like ketchup. That's terrible. All right, activation goes along with double D. Mediators of inflammation trigger the appearance of selectins and integrins on the surfaces of endothelial cells and PMNs, respectively. Wow, that's a lot of big words, doesn't it? So activation is typically the response of the body to something that it does not like. So mediators of inflammation. In other words, I'm going to start to swell. I'm going to turn red. My body temperature might rise a little bit. And that is, we know endothelial, right? Inside the cells on the surfaces of our skin typically is where this is going to happen. So I'm going to start getting a rash, things like that. Okay. I haven't seen those words in a long time. 28, adhesion goes along with double G, attachment of PMNs to endothelial cells. And our PMNs are that polymorphonuclear neutrophils in just a second, right? So adhesion is when those cells are sticking together, right? So like we talked about earlier, adhesion is any time that you have too much of something in your body, like scar tissue, things like that, right? That's an adhesion. Here, they're specifically talking about your neutrophils are going into the cell walls. So 29, transmigration. I don't have any idea what this word is. PMNs permeate through the vessel wall, moving into the interstitial space. This sounds like edema, doesn't it? This sounds like we're getting a lot of stuff in the interstitial space that isn't normally there, right? So chemotaxis, number 30 is double A, sorry. Movement of additional white blood cells to an area of inflammation in response to the release of chemical mediators. Remember, our body communicates with chemicals and with electricity, right? So chemotaxis is literally we're moving white blood cells and saying, hey, something inflamed us. We need to send some white blood cells down there, because what do white blood cells do? They eat all the bad stuff, right? They are the body's response to a disease process. So when I have increased white blood cells, I might say I have an infection, right? So when my body sends those in an area of inflammation, it's called chemotaxis. So number 31, BB, let's see. That is our PMNs, are types of white blood cells formed by bone marrow tissue that have a nucleus consisting of several parts or lobes connected by fine strands. So that polymorphonuclear, so poly meaning many, morpho meaning different shapes, nuclear, so it literally means it has several nucleus. Typically, a cell only has one nucleus, so these guys are very specific. And a neutrophil is a type of white blood cell anyway, so PMNs are a very specialized type of white blood cell. 32 goes along with double I, cytokinase, products of cells that affect the functions of other cells. So cyto always meaning cell, kinase means action. So the products of cells that affect the functions of other cells. So maybe like a chemical mediation, the cell puts off a chemical or it sends out a strand to attract somebody else. Interleukins, number 33, goes along with double E. They attract white blood cells to the site of injury and bacterial invasion. So an interleukin, would have some cytokinase with it, right? It's going to use that chemical to send white blood cells over to the bacteria so that the white blood cells can eat them, right? Phage. Interferon is Z. Let's go back up. Let's see what Z was. Z, protein produced by cells when they are invaded by viruses. So a protein produced by a cell when it's invaded by a virus, why would that cell do that? Yeah, it's going to interfere with the virus, right? So there's actually a medication used for Hep C that has a very similar name. And that's why, because Hep C is a virus. So when we take this medication, it inhibits that Hep C from proliferating in our body. So it's going to be a protein produced by the cell to kill the virus, right? Lymphokinase 35 is CC, double C. It stimulates leukocytes. So that kinase is that kinetic energy, right? Lympho, we know, is going to be part of our white blood cell system. So we're going to stimulate leukocytes. Leukocytes are white blood cells. Wow. Lots of big words. Okay. Lots of big words. Questions about anything specific? Let's hope not, because I may not have answers for specifics. All right. So all of this so far is on the cellular level, right? As EMS, we do not deal a lot with cellular level, but it's important to understand how the cellular level works, because if I give a med to stop a reaction, I need to know what's going to happen, right? So let's break it down to a distributive shock, right? Distributive shock, name one that would go along with the majority of what we've been talking about here. One type of distributive shock. There's only two that we've studied, but what are they?
The anaphylactic shock.
Anaphylactic. So anaphylactic shock is one, right? And what about septic shock? Both distributive types of shock, right? Why are they called distributive shocks? Because they go through multiple body systems, right? They affect multiple body systems. So anaphylaxis would be all of these triggers happening, right? Like, oh my gosh, we're sending all of these things. And it's like, oh my gosh, we have a hypersensitivity to something. I'm starting to swell. So I have that edema. So all that plasma is leaking in my interstitial spaces. It's causing my lungs to fill up with fluid. Like, it can be all kinds of things, right? What does epi do? So if I have an anaphylaxis, a distributive shock that's causing hyperpermeability of my capillaries, it's causing everything to dilate and leak. Epinephrine comes along. It's a vasoconstrictor, right? Bronchodilator. So when it constricts those vessels, it brings them back together. Because when a vessel gets bigger, it gets more permeable, right? Like a cheesecloth. So if cheesecloth gets old and it gets too many holes in it, then all my stuff falls through and it doesn't filter anymore, right? So with cheesecloths or with hyperpermeability, I want something that's going to bring that back together. So I want it to leak out a little bit, but not a lot, right? So epi just stops further leakage. It doesn't actually bring the swelling down. It just makes the swelling not get any worse, right? So if I give epinephrine to someone who is having allergic reaction, having anaphylaxis, I can't expect that person to immediately begin breathing well and for the swelling to go away. That's not how this works, is it? But I can expect them to not get worse, okay? So as long as I understand what it does on a cellular level, then I know that I'm still going to have to transport this dude and still going to have to really watch their airway and possibly give more epi, right? Because how long does it last? Like, yeah, 2 to 5 minutes, right? 2 to 5 minutes. How long is this going to last in the body? Hours. We have hours of this immune response. Okay. So knowing how things work on a cellular level, important, but, probably won't kill anybody. Let's hope not. All right. Let's go through the multiple choice really quick. Everybody still good with us?
Okay.
All right. Perfect. Okay. So read each item carefully. Wow. Like we're going to read them not carefully. All right. The degree of fluid imbalance required to compromise homeostasis and cause illness depends on the patient's what? So what does that mean, fluid imbalance? What kind of shock would we be referring to? Hypovolemic, right? Hypovolemic shock causes fluid imbalance. Does that mean they are bleeding out? No. Does that mean that they have less fluid in their vessels? Yeah. So we're losing fluid from the vascular system, right? And it's going elsewhere. So my fluid is going elsewhere from the vascular system, which means that my heart cannot pump appropriately, right? So it just means that it's going elsewhere. So if I'm losing fluid from my vascular system, it's going into my interstitial spaces. I'm peeing it out. I'm diarrheaing it out. I'm vomiting it out, right? So I'm losing that fluid from my vessels, okay? And this is going to compromise my homeostasis. So when does this matter? So if I have 3 days of nausea, vomiting, and diarrhea as an adult, am I going to die? Me personally, as a fairly healthy adult, probably not, right? My body can handle this, right? Probably lose some needed weight, okay? But what if I have a 3-day-old infant? Yeah, 1 hour of nausea, vomiting, diarrhea can kill this kid, right? So size, age, and underlying medical conditions all matter, don't they? So what if I have somebody who already has, a wasting disease? They're already like really underweight. They just can't, keep their nutrients down, and they have an illness which causes nausea, vomiting, diarrhea, or a diabetic patient, right? That just can't keep the sugar in and they're still taking their insulin. These are all really important things to remember, right? So when someone calls us and says, man, I've been having diarrhea for 4 days, and I'm like, really? Did you take some Pepto? You know what I mean? We need to have a lot more compassion, because what if this person is 4 years old? That diarrhea for 4 days could kill this child, and parents don't always recognize that, right? So size, age, and comorbidities all play a part in this. So the correct answer to this one is D, right? So hypovolemic shock, fluid imbalance, right, can compromise homeostasis and cause illness. And it depends on, the patient, right? Lots of the patient. All right. An increase in the size of cells due to synthesis of more subcellular components, which leads to an increase in tissue and organ size, is called megaly. I know this one. All right. But let's look. A. So this is hypertrophy. So what does hyper mean? Too much, right? Too much. Trophy literally means size of the system, right? So atrophy means to shrink down. Hypertrophy means to get bigger, right? So I might have cardiomegaly is another word, right? So, but a hypertrophy, I'm trying to think of a word that has, like, specifically will have this. Your liver can swell, your heart can swell, your spleen can swell. Typically when it's an organ, it's called megaly, right? We'll have to look up some words, but hypertrophy is literally when we get too much stuff inside a cell and it gets bigger. We're going to have corresponding, right? If I get welts on my face, I've got skin that now has some hypertrophy in it, right? Ooh, this one's fun. And you're going to see this more than once. When a patient hyperventilates and has carpopedal spasms, what is a carpopedal spasm?
Is that where you like grab the hands?
Yeah, exactly. Like when my hands are like, oh, and I'm like, I can't, like, yeah, and they're
Okay.
like all their hands are all spasmed up, and my fingers are like, oh, right. And you're like, okay, what's the problem? Why is this happening to them?
Because they have too much acid buildup.
Yeah, because they got too much oxygen. We're not letting that carbon dioxide blow off, right? And they're like,
Right.
oh, I'm really, and you're like, just stop breathing. Seriously. Give them a paper bag, stop breathing. So number 3, let me double check my answer, make sure we're right, is D. So respiratory alkalosis, right? Basic, we have not enough acid actually. So we're not blowing off my carbon dioxide, right? Why is it respiratory? Because they're what?
Hyperventilating.
Hyperventilating, right? So this is not metabolic. Metabolic is always kidney. Always, always, always. Metabolic is always kidney. Respiratory is always breathing. Okay. So when you get to your AEMT test, if it has anything to do with kidney, it is metabolic. If it has anything to do with respiratory, it is respiratory. Okay. That's the easiest way to remember those. Okay. So respiratory alkalosis. All right. And it's, yeah, give them a paper bag, man. What's our equivalent of a paper bag? Non-rebreather with 2 liters of O2, right? Yeah. Yeah, or bag them. We could just totally start bagging them. Just take it over, right? Which of the following is not considered a neuromuscular disease? I'm going to say C as well. So neuromuscular is literally the nervous system affecting the muscular system, right? Schizophrenia is quite literally a psychiatric disease, which has nothing to do with the muscles, right? All the rest of these are very specific to muscles and nerves, all right? 5 is B. A blank is a foreign substance. So an antibody is something my body creates, right? So my body creates something that's like, whoa, I didn't like that very much. We're going to make some antibodies against that and protect us, right? Immunogen, same thing. A lymphocyte is a white blood cell. So an antigen is something that comes into my body that wasn't there before. Let's scroll it up. Woo, there we go. So a blank is an antigen capable of generating an immune response. So let's see what this one is, right? Yeah, it's pretty sure it was C. Immunogen. So if I give myself something, let's say we have an acquired immune, right? And I give myself a shot with a live vaccine in it, I have introduced an antigen, right? But I want that immunogen because I want to be able to fend off whatever disease process it was, right? This is how we eradicate diseases, by honestly giving our body a small dose of that, lets it get used to it, develops the antibodies, and now we don't get the disease, right? Because my body can fight it. Very simplified version. When examining rates of disease, which of the following terms refers to the number of new cases of a disease in a population in a given time period? I want to say this is prevalence, but let's look at it. 7 is A. It says incidence. Okay, sorry, I was wrong.
No, I was thinking the same thing.
Yeah. So incidence of disease in a given time period is how we determine how many new cases there are, I guess, how many incidents. I don't know. I would have thought prevalence. Maybe prevalence is more about the percentage of total. Possibility. Ooh, common causes for hypokalemia. Let me scroll up a bit, guys. What is hypokalemia?
Yes.
Not enough what?
Nothing.
Not enough.
Nothing.
No, you're right. Potassium. Not enough potassium in the blood. Not enough potassium in the blood. And it's easy to remember because calcium is literally calc. Yeah, it'll say calc in it, right?
Yeah.
So K is always potassium, Ca is always calcium, all right? And Na is always sodium. And those are elements, right? On the, what's it called? The pediatric periodic. Wow. Anyway, it's the P word of elements, like the big table with all the symbols. Okay. So common causes for hypokalemia. So not enough potassium in my blood, all right? So not enough potassium in my blood. Ooh, I was right. Renal potassium loss. So which one of these, if we didn't know the answer to this, okay, if we know that hypokalemia is not enough potassium, and I look at this, excessive dietary potassium intake, is that going to cause hypokalemia?
No.
No, it's going to cause hyper, right? It's going to cause too much, right? What about increased calcium loss? Yeah, it'd be hypocalcemia, right? So we're going to lose calcium, right? What about neoplasms? Those are tumors. So no, that's not going to cause it, right? So the only thing here that is causing a loss of potassium is renal potassium loss. And that means my kidneys are filtering out too much potassium. And these are disease processes, right?
So I got a question. Do they always put like Ka, Ca, and Na in those words so you know what they're talking about?
Yes, that's exactly what it is. So hypokalemia, literally K means potassium. If this was hypocalcemia, it would be low calcium. Hyponatremia is low sodium.
Okay.
Yep, those words literally mean what you see on the periodic table of the elements.
Okay, cool. Thank you.
Yep, always. Ooh, here's another one. Hypomagnesemia. Is the magnesium level lower than B? I do not know this answer. I don't know my lab values anymore. So I quit working in the hospital. I gave it all up. Hypomagnesemia. So this is low magnesium levels. This can actually cause a lot of problems because it causes muscle cramps, it causes brain fog, cause memory loss. Like there's all kinds of things that magnesium does in your body, right? It's one of our electrolytes. So we need at least 1.3 milligrams per deciliter. And a deciliter is 10 liters, right? So 1.3 milligrams per deciliter. It's the same measurement that we do for sugar. Blood glucose is also measured as deciliters. So number 9 is B as in boy. All right. Number 10, symptoms of hypermagnesemia include all the following except what? So number 10 is all the following except A, tachycardia. So we're going to have muscle weakness, decreased deep tendon reflexes, and altered mental status. So magnesium threonate is one that I take for memory and for just general brain issues, right? So increasing that magnesium threonate means that it passes my blood-brain barrier and helps with that kind of thing, right? I also know when my magnesium is low because I get cramps in my muscles really bad. But these 3 things, these are too much magnesium in the body, right? So my body is trying to get rid of this and it's like something is wrong. But magnesium doesn't affect the heart rate. So that one would not be there. All right, an isotonic fluid. I was in the grocery store the other day and on the sign, the signs above where everything is, right? Isotonics in the drink aisle. I know, right? All the drinks they sell are isotonic. Like this doesn't make any sense. Or hypotonic, right? Because Water is hypotonic. There's not enough salt in it, right? So how do you have a beverage that is isotonic? Like that's literally like a pH salt water. And I was like, that is the dumbest thing I've ever seen in a grocery store ever. Okay. Like it doesn't make any sense whatsoever. I think what they're selling are electrolyte solutions that are very close to the pH level of the body. That's the only thing I could think. But I was like, why in the world would you put isotonic on your grocery store sign? Like whatever. So anyway, we carry isotonic IV fluids, right? So LR and NS are isotonic. So they're so similar to the body that the body can't tell the difference. So isotonic fluid deficit is the most common form of fluid loss and is often the result of what?
Sweating.
Yeah, sweating. There we go. So why not vomiting and diarrhea? Those are typically hypotonic. Yeah. So hypotonic is less sodium.
You're sweating. Now you can taste this.
You can taste the salt. That's exactly right. So when we sweat out electrolytes, including sodium. There you go. Na. So hyponatremia, right? So in isotonic fluid deficit, we could vomiting and diarrhea and sweating cause a hypovolemic shock. Absolutely. Could sweating cause hypovolemic shock? Yeah, eventually, right? When do we get worried about our patient that's had a heat emergency?
When they stop sweating.
When he stops sweating, because that tells me that his body has said, whoa, this didn't work. And now we're going to conserve the rest of that sodium for us. Okay. So isotonic would be sweating because it has salt in it, right? Vomiting and diarrhea are hypotonic. We're not vomiting out electrolytes. We're just vomiting out fluid or diarrheaing, whatever. Fever, that doesn't cause any fluid deficit necessarily. That's kind of odd. All right. So let me scroll up. Sorry about that. Hypernatremia. First of all, hyper is too much, right? What is natremia?
Too much sodium in the blood.
Too much sodium in the blood. And the rest of the question tells you, right? Clinically defined as a serum sodium level, serum meaning blood, sodium, Na, right? Of how much? Let's see. C. Ooh, 143. Look at that. So we know that you have to have a minimum, wasn't it like 135? Yeah. So now our maximum is going to be 143. So 143. So if you ever use those alphanumeric pagers 150 years ago, okay, 143 is a code for I love you, right? So if there's too much salt in my blood, I can't say I love you anymore, right? Yeah. Anyway, clearly I was dating when those pagers came out, or when I had one anyway. All right. Causes of what? Hypercalcemia. What does this mean?
Too much calcium.
Too much calcium where?
In the blood.
In the blood. Too much calcium in the blood, right? Can we have too much calcium in our diet?
Yes.
Yeah, you absolutely can. It makes your poop white. So literally, like your body will get rid of it. But if it actually gets into the blood, that's when it becomes emia. Okay. So hypercalcemia. What number are we on? 13? Okay, good. I was right. Whew. All right. Can include all the following except what? So excessive antacid ingestion. What are antacids made of?
Aren't they made of calcium?
Calcium. This is why they tell pregnant women to take Tums. Calciums. Yeah, Tums. They're made for your tummy and it's calcium. Yeah, because it increases your calcium, which is good for pregnant people, right? But if you have too much of them, you can actually have hypercalcemia, right? Yep. Cancers can also cause hypercalcemia because it changes the cellular system. It changes the cells themselves, right? Diuretics. What's a diuretic? Makes you pee a lot. Yep. It's a water pill, a fluid pill, right? These are over the counter. Sarcoidosis. I don't remember what this word means, to be honest. We can look it up in a second. So if we are peeing out a whole bunch of stuff and I'm not allowing that calcium to filter through my system, this can absolutely cause hypercalcemia. So 13 is going to be D. Alcoholics. That's not a cause of too much calcium in my blood. I don't remember what sarcoidosis is. Are you looking it up?
Condition that develops when it breaks the cells in your immune system or red and swollen lumps.
Oh, red and swollen lumps caused by an immune system response. That's sarcoidosis. There we go.
Granulomas? Is that how you said it?
Granuloma? Yeah. So they're benign, but okay, interesting. Didn't know that word. But even if we didn't know, we can still figure it out, right? Does alcohol contain any calcium at all?
Nope.
No. And typically alcoholics are going to be they're going to be deficient in nutrients, right? Because they're not eating appropriately. So it's not going to cause a hyper anything. All right. So deductive reasoning. Which of the following is a sign of respiratory acidosis? All right. So acidosis, remember, is when my pH gets too high. Okay. So it's kind of the opposite, right? So bradypnea, what is that?
Breathing too slow.
breathing too slow. Okay, so is that related to respiratory?
Ouch.
Yes. Blurred vision. Let's make sure I'm right. Blurred vision. Could that be a sign of multiple things, right? Your eyes are dry, you're drunk. Okay, cool. Fever. Okay, does that have anything to do with respiratory? No. Confusion, anything to do with respiratory? Could be hypoxia, right? Yeah. So bradypnea literally is not breathing fast enough to exchange gases. And this can absolutely cause respiratory acidosis. Do you remember what caused respiratory alkalosis earlier?
I don't like those words.
Hyperventilation, right? Hyperventilation caused alkalosis, too much oxygen in my blood, right? Bradypnea, hypoventilation causes acidosis, not enough oxygen in my blood.
Light bulb.
Yeah, and those are hard. You're just gonna have to like literally make you some flashcards and memorize them because my gosh, it's yeah. We don't think about these words very often. All right, so all the following are factors associated with upper gastrointestinal losses that can lead to metabolic alkalosis, except what? So metabolic alkalosis is going to refer to the kidneys. Okay, so it has nothing to do with breathing. All right, it's going to have everything to do with electrolytes in the body. So how we're getting rid of those electrolytes, right? So except what? So metabolic alkalosis means that my pH is getting too high. So let's see. Except excessive water intake, excessive vomiting, excessive diarrhea, and nasogastric suctioning. So if I'm looking at upper, make sure I'm right. If I'm looking at upper GI, where is my upper GI? What's it relate to? Stomach and above. Okay. So excessive water intake, where is that going? Into the stomach, esophagus and stomach, right? Excessive vomiting, where's it coming from? From the stomach. Excessive diarrhea, where's that coming from? Lower intestines, okay, intestines. Nasogastric suctioning, what does that word mean?
Suction.
I have a suction tube in my nose down into my stomach, and I'm suctioning out stomach contents. So of those four, only one of them is not upper.
C.
It is C. It is diarrhea, right? And why do we have diarrhea? Do you know what that is?
It's where doesn't it? It's never mind. I'll let somebody else say. But I think it's
feces. Yeah, as feces goes through your body, as it goes to the large intestine, all the water goes out of your large intestine and into your vessels. It goes into the bloodstream, right? So as poop moves through the large intestine and the small intestine, it slowly sucks all the water out. So if we don't have time, if I have food poisoning and my body's like, whoa, bacteria noted, it's going to eject everything, including the water. So I have diarrhea because it didn't stay in my intestines long enough to suck out the water, right? So now, alternatively, how do you get constipation? It's sucking too much water out. The poop stays in your intestines for too long. So it goes to the large, it goes to the small, and it's like, hey, we're still here. Okay, cool. We'll pull some more water out, right? We'll pull some more water out. We'll pull some more water out. 5 days later, you're like, pooping a brick that is solid rock and super hard and dry. And your kid has these little pellets, right? Because there's no water in the feces. So if you're going every day, there's an appropriate amount of water. You have soft formed feces, right? You got poop, regular poop, right? But if you poop too often, you might have some watery poop, or it might be a little thinner. It might dissolve faster, right? Because it has more water content. If you only poop once a week, can it be wet? No, it's been in there for way too long, right? You're going to be constipated. It's going to be dry. So water is actually absorbed through the intestines into the vessels. So that's what causes diarrhea is I didn't have time. That poop was going through my system so fast, my body didn't have time to get the water out, which is why we become dehydrated when we're having diarrhea, because I'm not uptaking any of that water that was coming through. And it doesn't have to be water. Like it's not like drinking water, right? It's water from your food. Like I'm eating soup, I'm eating watermelon, I'm eating oranges. There's water in that food, right? But I didn't get to keep that. It pooped out, literally. Yeah. Okay. Anyway, side note. All right. So inflammatory response can be triggered by an agent that is so what's an inflammatory response? Yeah, swelling up, right? Inflammation, literally inflammation is redness and swelling at the site. And we know that this is caused by fluid going into the interstitial spaces. Could it also be red? Yeah, our cells are super irritated, right? Might even be some cellulitis going on there, right? So what can cause that? All of these things, right? If I brush up against poison ivy, what's going to happen? Dude, that's a physical and a chemical agent, right? Physically, it was the leaf. The chemicals in the leaf are what caused the inflammation response. What about microbiologic? That's a big word, right? That's a bacterial infection, right? Or viral. Yeah, exactly. So all of these can have kind of agents that can trigger inflammation. An abnormal gene may develop in a person by mutation of the gene during meiosis, by heredity, as a result of other causes later in life, or all of these are correct. So if we're going back to our cancer, right? All of these are correct, right? I might have an abnormal gene that predisposes me to breast cancer. That's heredity, right? I might also smoke and drink and have poor life choices and take a ton of hormones or whatever it is. And that can be, result of other causes later in life. And then my breast mutates during meiosis of those cells and they change just slightly enough that it causes cancer to develop, right? So an abnormal gene can develop any of those ways. And cancer is just one type of abnormal gene, right? This is also why, disease processes are passed down from person to person. Prostaglandins are found in many vertebrate tissues where they act as messengers in what? Prostaglandins are super cool because they actually are messengers for reproduction, for inflammatory response, and pain perception. So that all of these are correct. I was pretty sure, but I was like, just going to check. Prostaglandins are just cells that literally carry messages. That's it. That's all it is. They're like, oh, look at this. I got a note. Let's pass it to the next person, right? That's all they do. They're just chemicals. In response to hypoperfusion, what is that? What's exchanging? Not enough gas exchange at the cellular level, right? So too low gas exchange at the cellular level. So my breathing could be off. Maybe there's not enough oxygen in the air. Maybe I have a toxin, something. The body releases catecholamines such as epinephrine and norepinephrine, which produce what? Make sure I'm right. D. Okay, so the answer is D. Increased strength of cardiac contraction, increased pulse rate, increased systemic vascular resistance. So hypoperfusion. When might that happen? When I would be giving someone epinephrine. Because I can give epi, right? I can give synthetic epinephrine. Why would I do that?
Shock.
Distributive shock. Very nice. What about cardiac arrest?
You have that one.
Oh yeah.
1 to 10 for cardiac epi, right? So in cardiac arrest, my body is releasing those catecholamines, but not at a rate that my body can do anything with it because of the hypoperfusion. Everything is shunting to the core, right? So if my body's producing it in the adrenals and it's going up and it's like, okay, cool, but it can't produce enough, right? So instead, I'm going to pound some in there because it's going to increase contractility, make my heart beat stronger, increase my pulse rate, make me beat faster, right? And increase systemic vascular resistance. What does that mean? Go back to your distributive shock, right? If everything is too permeable, there's too many leakage, right? I'm going to increase the vascular resistance, which causes that vasoconstriction, which causes that blood pressure to go up. So if I have someone with hypotension, there we go, blanks on the blood pressure word, I can give them epi, increases their heart rate, increases their pulse, and increases their blood pressure, right? So we can use epi for so many things. Norepinephrine, a brand name for that is Levophed. So if I have someone with a very, very low blood pressure, I can give them Levophed, and it will actually increase that blood pressure for them without causing some of the other problems. But this is what it does. So hypoperfusion, not enough cellular gas exchange, right? So instead, I'm going to get my heart to beat faster, stronger, and I'm going to get my blood vessels to constrict a little bit to help carry that oxygenated blood, right? Cool beans. And those are catecholamines. Yeah, that's just a weird word. Ooh, what is cardiogenic shock? Specifically related to what? The heart. We know that part, right? The heart is a mechanical and an electrical pump, right? So cardiogenic shock affects only one of those. Which one? The mechanical or the electrical?
What's the chemical? Or I mean the mechanical.
The mechanical. Cardiogenic shock is the pump. When my heart cannot pump, we go into cardiogenic shock. Nothing to do with the electrical aspect of it, okay? It's only the pump. All right. So we know that cardiogenic shock is the pump. So, and it occurs in ischemic heart disease. What is ischemia? When we have a what? of any vessel?
Blockage.
Blockage. Look at you go, right? So ischemia is the fancy word for blockage, right? Because it could be plaque, it could be fat, it could be
Cheeseburger.
yeah, cholesterol, right? Cholesterol creating that plaque. I'm trying amniotic fluid. It could be anything, right? It could be an ischemia. Okay. So ischemic heart disease typically is cholesterol. Okay. Too many cheeseburgers. So we have cardiogenic shock, which is a pump problem, ischemic heart disease, which means I've got some that plaque build up in the coronary arteries. Where are the coronary arteries? Around the heart. And they feed the what? The myocardium, right? What's myocardium? Muscle of the heart, the heart muscle itself. Okay. So cardiogenic shock is the pump problem. Ischemic heart disease is when we have too much plaque buildup in the coronary arteries. So now we have a loss of how much or more of the functioning myocardium. And what's myocardium? Heart muscle itself, right? Let's look this up because I honestly don't know the answer to this. They say it's C. So 40% or more. So now we know that if 40% of my myocardium, my heart muscle, doesn't function well, I'm going to go into what kind of shock? Cardiogenic. Could this also be coupled with other things? Could this look like distributive shock? Because what's going to happen to your blood pressure? It's going to go down. Yeah. What's going to happen to your heart rate? Probably going to go down, right? Like all kinds of problems happen with cardiogenic shock, but it's very, very specific to the pump of the heart. Okay. Not the electrical. It is the physical heart itself. All right. Cool. And they love questions about cardiogenic shock. All right. So blank refers to the total number of cases of disease in a particular period. Let's see, 21 is B. So this is prevalence. So yeah, so prevalence earlier, incidents are the number of new cases. Prevalence is the percentage, the total number of cases. We got those confused, but that's okay. I don't think anybody cares. All right. And morbidity refers to the damage or suffering caused by the disease. So we know that morbidity can be hypertension, heart disease, stroke. All of these are morbidities, right? When I have a comorbidity, then I have more than one disease process, right? So incidence is the number of new cases. Prevalence is the total number of cases. Morbidity is the damage or suffering caused by the disease. So what is mortality? The number of deaths. So the mortality is literally the number of deaths for that disease process, right? So when we do a morbidity and mortality report, like at a hospital, we go through how many of each case were admitted this month and how many people died. So a morbidity and mortality report is very important to determine, are we treating these diseases appropriately? And we use incidence and prevalence in those reports. Oop, sorry, I went too far. Let's go back up one. Okay. So blank is a chronic inflammatory condition of the lower airway. Okay, what's chronic mean? Continuous all the time, right? What is acute? Sudden. So very, very sudden, right? So sudden would mean acute, acute, right? Like right now. Chronic is something that's all the time. Inflammatory, we have swelling, we have redness, we have just irritability, right? Lower airway, resulting in intermittent wheezing and excess mucus production. We should already know what this is, but let me make sure that I'm right. What do you guys think it is?
Emphysema.
Ooh, that one's a good guess. Why is it wrong?
I don't know. I was wrong.
So emphysema is not intermittent. Emphysema is chronic and it's all the time. Yeah.
Okay.
So emphysema is where you get that barrel chest, right? And it's all the time. And so the chest actually the lungs can't expand. And so when you have emphysema over time, your chest cavity actually gets bigger because we get that air trapping and it's constant, chronic all the time. Can't just, that emphysema is a constant thing. Asthma is intermittent, right? Because it can be triggered, right? So asthma is a chronic disease process that you can live with for months or years at a time and not have any issues with. And then all of a sudden you go outside and the hay is super high and you're like, and we can't breathe, right? So asthma is intermittent. What about chronic bronchitis? Why is that one wrong? Bronchioles are upper airway. Exactly. So emphysema and asthma are both lower airway diseases, right? Bronchitis is an upper airway disease. And what about pneumonia? You absolutely produce mucus, right? Does it cause wheezing? Not typically. Right. Pneumonia can, but it's when everything is constricted, right? So a chronic, and is pneumonia chronic?
No, it's
No. Pneumonia is always an acute disease. Okay, so that one's out. So chronic bronchitis, it could be, except that's an upper airway, right? Emphysema and asthma are both lower airway, but of those two, which one is only intermittent? And that's your asthma. So deductive reasoning. Okay. Ooh, shock. What kind of shock occurs when there is widespread dilation of the resistance vessels, capacitance vessels, or both? So resistance and capacitance are arteries and veins, okay? So what kind of shock causes widespread dilation of vessels? Distributive, right? Distributive, where it goes all through my body all at once, affecting everything, right? Everything. So hypovolemic is that low fluid volume, right? Distributive shock is like, oh my gosh, something bad has happened. My vessels get permeable, they get bigger, they start leaking, all kinds of stuff, right? So our arteries and our veins are affected. Our resistance, our arteries, our capacitance, the vessels that hold blood and cause it to go back up, right? There's no such thing as mechanical shock. I don't even know what that means. What's mechanical shock? What's obstructive shock? Blockage. A blockage. Name one that is a fast killer. It occurs in the lungs, typically in the pulmonary vein. Pulmonary embolism. Yep, that is an obstructive shock that will kill you super fast. They're like, I'm having trouble breathing. Boom, they did. All right, bad. Distributive shock was the answer, right? What's cardiogenic? What does it affect? The heart itself, the pump. Does it have anything to do with the vessels? No. So cardiogenic shock is very specifically to the pump. There's no such thing as mechanical shock. Obstructive shock is where everything is fine, except now we have a blockage and we can't get blood through. So distributive shock, dilation, right? Distributive dilation. Ooh, spinal cord injury. Very, very specific type of shock. What is it? Neurogenic. Because it's neuro. So septic shock is distributive, right? We know that one's wrong. Anaphylactic shock is also distributive. Hypovolemic is low volume, right? So does spinal cord injury automatically mean that you're losing volume? No. Will it cause a drop in blood pressure? Yes, but not because of volume. Okay, so spinal cord injury is always neurogenic shock. We need to pull that Beck's triad out for you guys.
I'm sorry?
Beck's triad will show the neurogenic shock. Yeah, we'll pull it up. Which of the following is not one of the immune system's line of defense? Ooh, okay. So what's an anatomic barrier? Skin, mucous membranes, right? Yeah. So these are anatomic barriers. So something that my body has that stops something from getting into me, right? An acquired response, an immune response, or an inflammatory response. How do I get a required response?
Acquired, you've been exposed to it before.
Yeah, exactly. So there's actually no such thing as an acquired response, right? So that's going to be the answer, okay? Because that is not an immune system line of defense, but we can have an acquired immunity, right? But an acquired response is not a thing. But an acquired immunity means something I have been exposed to. I have either been vaccinated or have had this thing before, and now my body knows how to fight it, right? And that is the immune response, which can sometimes be inflammatory, okay? All right, let's look at 28. 28 blank is a highly specific, inducible, discriminatory method by which armies of cells respond to an immune stimulant such that the immune system will never fail to recognize the same stimulant when it is subsequently encountered even years later. How specific is that, right? This is acquired immunity. This is when I give my body a shot of flu vaccine and it's like, oh my God, we're going to kill this forever, right? A better example of that is tetanus. So if I give my body a shot of tetanus toxoid, it knows to kill the tetanus for 10 years, right? It stays there. That acquired immunity is there. Natural immunity is what you're born with. I don't know what native immunity is. Humoral immunity, I'm pretty sure is cellular. But that's the only one I know. I don't think there is such a thing as native immunity. I'll have to look that one up. But acquired immunity is specific to vaccinations. All right, characterized by the formation of a population of lymphocytes that can attack and destroy foreign material. A population of lymphocytes, not just one, man. We got a whole army of white blood cells coming after us, right? Let's make sure I'm right. All right, so this is C. 29 is C, cell-mediated immunity. So not acquired. We know that that's vaccination. Natural is what you're born with. Or if you breastfed or pumped for your kids, then you can have some natural immunity there. Humoral, we're going to have to look that one up because that word is there again. And I don't remember it. I want to say that that's a cellular response, but could be wrong. We're going to look up humoral immunity. So while we look that one up, let's read this one. So is the formation of T cells or antibodies directed against the antigens on another person's cells. Oh, so typically after the transplantation of an organ or tissue. So this one is going to be isoimmunity is what it should be. Yeah.
Humoral immunity is the aspect of immunity that is mediated by macromolecules, including secreted antibodies, complement proteins, and certain antimicrobial.
Perfect. So humoral immunity is the cellular response of the body. I was pretty sure, but I wasn't positive. And it's going to be overall response, right? So isoimmunity literally means one. So I am like, I have a new liver, and the body's like, whoa, we didn't grow that liver. We don't want it. So it's going to attack just the transplantation. All right. 31 is D. Autoimmunity is the production of antibodies or T cells that work against the tissues of one's own body. How do we know that that's the answer? Autoimmunity. Auto meaning self. My body is fighting against itself. There is an autoimmune disease, such as lupus. My body's like, nope, that didn't look good. Let's eat it. Social and psychological effects of obesity include all the following except a positive self-image, anxiety, rejection, or discrimination. Dude. Yeah, let's go with A. All right. Concepts related to physiologic stress include what? So physiologic stress is literally the body's response to stress. This is the body, how my body reacts, right? So it's going to include all of these things, the stressor itself, the effect on the body, and the body's response to stress. So 33 is going to be D. And these can be high cortisol levels. They can be weight gain. They can be memory loss. There's all different physiological responses to stress. I have all of those. An abnormal accumulation of uric acid due to a defect in metabolism. Ooh, you ever seen anybody with like their foot is like their toe is ginormous and you're like, that's not good. Or they have a big swollen finger. Yeah, this is called gout. Gout is an accumulation of uric acid in a very specific place, typically fingers and toes. It's very strange. But if you have gout, it's your body's unable to get rid of the uric acid, okay? It is not a kidney stone. That's typically calcium. Ulcerative colitis is in your colon, and that's where the inside of your colon gets ulcers, literally. What is hypercholesterolemia?
Too much cholesterol in blood.
Too much cholesterol in the blood. We are producing plaque at this point. All right. So uric acid is very specific to gout. All right. It's considered a mild hypersensitivity reaction. So allergic rhinitis, what is that? What I have today, when your nose is runny, right? Bronchial asthma is when you walk outside and the pollen is high and you're like, we have a lot of mucus develops in the bronchioles. This is not truly an asthma. It's not truly a disease process. It's your body like, nope, get that fluid, get that mucus there to trap all that pollen. A wheal or a flare is when the body whelps up a little bit in response to a pathogen and antigen, right? So all of these are correct. These are all mild reactions, okay? A little bit of drip and clear nose, no big thing. A little bit of mucus production in my bronchioles to keep that pollen out. Maybe a little bit of flare up on my skin, mild. We don't need to fix those. The body is doing its job. 36 is C. Graves' disease is an autoimmune disease caused by thyroid stimulating or thyroid growth immunoglobulins. So this is when the body itself attacks the thyroid and then it goes out of control, basically. You usually have to remove it. Huntington disease is a neuromuscular. Alzheimer's is specific to the brain, decrease in brain tissue. Endocrine diseases are anything doing with the endocrine system, right? Kidneys, etc. Diabetes, exactly. Treatment for cancer. Wow, this one should be easy, right? Totally depends on all of the above, right? If I've got a skin cancer, I can just cut it out, man. But if that skin cancer has metastasized, that may not be an option. All right, we still doing good? Okay, let's do some true false. Woo! All right, let me look these up and let's make sure we're right. All right, so Hypoperfusion occurs when the level of tissue perfusion decreases below normal. This is literally the definition of hypoperfusion, right? All right. Hypocalcemia can be caused by endocrine disease. This is absolutely true. So our body could be filtering out too much calcium. So we don't have enough calcium in our bloodstream. All right. So number 3, the clinical manifestations of edema may be local or generalized. Yeah. What is edema? Swelling into the interstitial spaces, right? So fluid accumulation. Could it be local? Yeah. Absolutely. I get a bee sting and I start swelling up, right? But what if I have anaphylactic shock? Yeah. This is systemic, right? Yeah. All right. Sodium is the second most abundant intercellular cation after potassium. This is false, actually. So sodium is the second most abundant. It is not the second most abundant intercellular cation, because I don't think it's a cation, but we'll look that one up. Ketoacidosis is associated with an insulin deficiency or desensitization of cells to insulin. So where else do you hear about ketoacidosis? You ever heard of the keto diet?
Oh, yeah.
Yeah. Yes. This is literally people that are not eating enough carbs. And so they actually become insulin deficient. Their body is using other things. So they become desensitized. So ketoacidosis can occur with diabetics, diabetic ketoacidosis, or you can also put yourself into keto. Long-term ingestion of lead, wow, such as chewing on windowsills painted with lead-based paint, leads to brain injury and neurologic function. I'm pretty sure that's true. Okay. Ooh, this one's good. Number 7, phagocytes are red blood cells that engulf and consume foreign materials such as microorganisms and cellular debris. So this is false because a phagocyte is a white blood cell. So phagocytes are like macrophages. They're like, yeah, and they literally eat the bad blood cells and all kinds of other stuff, but they're white blood cells. Apoptosis can be activated prematurely by pathologic factors such as cell injury. So apoptosis is cellular death, right? When they literally just dissolve. This can absolutely be true. This can be, you can have all kinds of reasons for cellular death. Acute inflammatory response involves vascular and cellular components. This is absolutely true, right? Because those cells are dilating. Those vessels are dilating, becoming more permeable. And then all of that stuff is going into the other cells, right? All right, number 10, go back to my page. When hypoperfusion overwhelms normal compensatory mechanisms and the patient's condition progressively deteriorates, this is called compensated shock? No, this is decompensated shock, right? Do children have decompensated shock? No. Kids compensate, die, right? Adults compensate, decompensate, and then they might get better or they might die. Kids do not have decompensated shock. So when we overwhelm our compensatory mechanisms, when we can no longer compensate, this is called decompensated. Endogenous hypovolemic shock occurs when the fluid loss is contained within the body. I want to say this is true. This is true. So endogenous, inside hypovolemic shock. How do we have hypovolemic shock when the fluid never leaves the body? Name one.
Internal bleeding.
Oh, could be internal bleeding. I like that. Yeah, I was going to go with distributed, but internal bleeding, the fluid didn't leave the body, did it? But did it leave the vessels?
Yes.
Yes. So we can't use that blood. Now it's all full up in my abdomen, right? So endogenous hypovolemic shock. In other words, it's not coming out. Say it again. Yeah, exactly. Yeah. Totally. So the blood is staying in their body. It's just no longer in the vessels. Septic shock occurs as a result of a widespread infection, usually fungal. That is false. It's actually usually bacterial, but okay. Could be a fungal infection, but yeah, it's still widespread infection, right? Normal capillary refill time is less than 4 seconds after blanching of the toe or finger, whereas a person in shock would have it greater than 4 seconds. This is totally false because it should be less than how many seconds? 2. Less than 2 seconds. Yes, less than 2 seconds. 4 seconds is a long time to wait for that blood to refill, right? Red blood cells of various types are a major component of the inflammatory response. No, white blood cells of various types are the only component of an inflammatory response, right? Pain from gallstones is located in the upper right quadrant of the epigastric area and may be referred to the back. Where's your gallbladder? Upper right. Yeah. So this absolutely can go to the back, and it's usually in that upper epigastric area. Okay. Morbid obesity is defined as an excessively unhealthy accumulation of body fats. This is true. The measurement of this is very, very specific and very subjective, right? I am considered morbidly obese. Yeah, I don't know either. Totally obese, but not morbidly. The hormone testosterone is not affected by stress. This is false. All hormones are affected by stress, always. Hypercholesterolemia is an elevation of the blood cholesterol level. True. That's literally what that word means. Too much cholesterol in the blood. The stress of trauma can cause immunodeficiency. Absolutely true. All right. Our body is not able to produce enough white blood cells to handle any kind of infection or any kind of response if we are too stressed and we're giving too much of that fight or flight. The high cortisol leads to lower immune system. Genetic disorders are related to a person's race when a defective gene is located on a sex chromosome. This is going to be false. Genetic disorders are not related to a person's race, but they can be a defective gene on the sex chromosome, right? You got it from a parent, which makes it genetic, but they're not related to race. They're related to genes, chromosomes. Teenagers are at a high risk of injury resulting from trauma and illicit drug and alcohol use. Teenagers are at a high risk of injury no matter what, okay? Because that reckless behavior is there. It's absolutely true. All right, let's scroll it. Sorry about that. Making everybody dizzy. All right, let's read each item carefully and complete the statements. Okay, so and these correspond to the workbook and to the book too, but respiratory alkalosis is associated with conditions that result in what? Breathing too fast or too slow?
Alkalosis, fast.
Too fast. Hyperventilation. Hyperventilation causes respiratory alkalosis, okay? Our pH is going to be too low. Respiratory alkalosis. The antibodies secreted by the B cells are called immunoglobulins. No, I don't know what those are. Profuse sweating can cause what, while excessive salt intake can contribute to what? So let's do with profuse sweating. And these are
Hyponatremia.
So it's actually not even going with hyponatremia. It's actually going with dehydration. I know, right? I would have said hyponatremia as well. Okay. But what is dehydration technically? It's just loss of fluid, right? Yeah. So it could still be hyponatremia. We could be losing salt. So profuse sweating can cause dehydration, while excessive salt intake can lead to hypertension. So hypertension is high blood pressure. So if we have too much salt in our body, it causes my blood cells to give more water into my vessels, which causes my blood pressure to go up because we're trying to balance out how much salt is in there, right? Number 4 is humoral immunity. In humoral immunity, B cell lymphocytes produce antigens called immunoglobulins, which recognize a specific antigen and then react with it. So humoral immunity for the cells, right? And I have these answers. I'll send them to you guys. Fluctuations in the level of blank in the body cause metabolic acidosis or alkalosis. Ooh, kidneys, bicarbonate. Fluctuations in the level of bicarbonate in the body cause metabolic acidosis or alkalosis. Whereas, what kind of disorders cause respiratory acidosis or alkalosis? Respiratory. I know, right? That's literally the word.
Oh, okay.
Yeah. So bicarbonate causes metabolic acidosis or alkalosis. Your kidneys are in control of the bicarbonate, right? Whereas respiratory disorders cause respiratory problems. Okay. Respiratory is respiratory. I can't say this word. Hypophosphatemia. Hypophosphatemia is a decrease in the level of serum phosphate. Hypophosphatemia. I know, right? Ingesting an excessive amount of ethyl alcohol. What is ethyl alcohol? Alcohol. Drinking alcohol, right? Not rubbing alcohol. Okay, that's different. Ethyl alcohol is typically the alcohol that adults consume, and it can cause alcoholic ketoacidosis. So alcoholic ketoacidosis is literally a metabolic problem where my body does not have the nutrients and the electrolytes that it needs to continue. So why they have alcoholic ketoacidosis. I lost my words. There we go. Okay, 8. Lactic acidosis is the product of anaerobic cellular respiration. How do we know this? You ever work out super, super hard?
Oh, yeah.
Yeah, and you get lactic acid in your muscles and your muscles are all crampy? Yeah, me neither. But that's lactic acidosis. And that's anaerobic cellular respiration. So when we run out of oxygen, we start using anaerobic metabolism. The replication of a virus occurs inside the host cell because viruses do not have their own organelles. Viruses are single-celled organisms. They don't have all the little pieces. They don't have any organelles inside, so they have to replicate inside another host cell, which is what makes them very difficult to kill. Number 10 is leukocytosis. Leukocytosis is elevated white blood cell count, often due to inflammation or leukocytosis.
It's like the leukemia.
It's very similar. Yeah, it's just that one's a very specific type in the blood. Whoa. Okay. Necrosis. Ooh, y'all know this one? Yeah. So this is actually morphologic. So necrosis, where did I go? Is the morphologic result of the changes that occur following cell death in living tissues. Morpho meaning shape. So morphologic. So necrosis causes the cells to die, right? Necrosis is the death of cells, right? Causes them to turn black, to slough off, to leak. Yeah. But morphologic result. After degranulation, mast cells produce, holy crap, vasoactive amines. Histamine, the most important of these substances are histamine and serotonin. So these increase vascular permeability, cause vasodilation, and can cause bronchoconstriction, nausea, and vomiting. So when you're having a distributive shock issue, you have vasoactive amines, which produce histamine and serotonin. These are terrible. So what do we take if we're having an allergic reaction? An antihistamine, right? And also epinephrine. Yep. Epinephrine is going to fix all of these, but antihistamines are going to fix the histamine response. And they help with serotonin as well. These are all kinds of big words, man. All right, so central shock. Central shock consists of cardiogenic shock and obstructive shock. So central, cardiogenic, heart pump, right? Obstructive is typically a pulmonary embolus, right? So very, very core. Whereas blank includes hypovolemic shock and distributive shock. So would those be central or peripheral? Peripheral. So peripheral shock includes hypovolemic shock and distributive shock. Obstructive shock occurs when blood flow becomes blocked in the heart or great vessels. So obstructive shock is not ischemic, right? It's not a cerebral vascular accident because we're still perfusing everywhere else, right? Obstructive shock is literally the aorta or the pulmonary vein, okay? In pericardial tamponade, diastolic filling of the right and left ventricles, the heart is impaired because, I should have read the whole thing, because of a relatively large amount of fluid in the pericardial sac, right? So pericardial tamponade is that sac around the heart that should not have any fluid in it, filling up with fluid and then squishing the heart, okay? So central shock, peripheral shock, obstructive shock, and pericardial tamponade. All right, 14. Ooh, this is the opposite of the one from above, right? The most common type of exogenous hypovolemic shock is external bleeding. It may also result from loss of plasma volume caused by diarrhea and vomiting, right? So exogenous, EXOGENOUS. So endogenous is that inside, right? If I'm bleeding internally and it's filling up my abdomen, filling up my pelvic cavity, all of that stuff is still there. It's not coming out, right? So it's inside. Exo means it's leaving. If I cut my arm and I'm bleeding out, that is exogenous. I honestly, I don't think I learned these things in paramedic school, but anyway. All right, 15. A true genetic risk is one that is passed through generations by inheritance of a gene. Genetic risk. So genetic risk of Tay-Sachs would be very, very specific to a very specific Jewish population, right? Inheritance of a gene. Primary MODS is a direct result of an insult, whereas secondary MODS is a slower, more progressive organ dysfunction. So this is on page 388. So page 388 of your book talks about primary and secondary MODS because I'm not entirely sure what that is. But we can look at it. All right, 17. The blank hypothalamic pituitary adrenal axis. Wow. Let me scroll up. All right, 17. The hypothalamic pituitary adrenal axis is a major part of the neuroendocrine system that controls reactions to stress. So hypothalamic, below the thalamus, the hypothalamus, right? Pituitary gland, and the adrenal glands. So apparently where they all come together is a major part of the neuroendocrine system. Lots of gigantic words. That's on page 418 if you have an advanced EMT book. 418. Wow.
The orange book,
I don't know what color it is.
we just call it the orange book.
Okay. It's all of this came from Jones and Bartlett. Yes.
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 Okay, yeah, that's what I got.
But I don't know what color it is. Multiple organ dysfunction syndrome. So multiple organ dysfunction syndrome is number 18, characterized by the concurrent failure of 2 or more organs or organ systems that are initially unharmed. So maybe my kidneys were okay before my heart got a hole in it. But now, no, we have multiple organ dysfunction syndrome. So my blood supply was inadequate for my kidneys to continue, even though they weren't hurt initially. We don't have enough blood and now they are injured, right? So that's very, very specific. 19, what is this one? Occurs when histamine and other vasodilator proteins are released on exposure to an allergen. What kind of shock? Anaphylactic. Anaphylactic shock. Histamine and other vasodilator proteins are released on exposure to an allergen. So 20, the blank response is the body's defense reaction to any substance it recognizes as foreign. So what system is going to go after all of this? The immune system. The immune response is the body's defense to any reaction or any foreign object. Sorry. There we go. All right. 21. Wow. The complement cascade ends with the formation of a set of proteins called the membrane attack complex. The complement cascade ends with the formation of a set of proteins called the membrane attack complex. Dude, I don't know, man. All right, so natural immunity is a non-specific cellular and humoral response that is the first line of defense. So this is natural immunity. This is what we're already immune to, right? When we're born. Wow. I don't even know these words, dude. Opsonization. Opsonization. Opsonization is number 23. In opsonization, an antibody coats an antigen to facilitate its recognition by immune cells. So the body opsonizes this bad cell so the body can recognize it. So it tags it, literally tags and is like, whoop, get rid of this one. So that's called opsonization. 24. The main feature of blank is an excessive thickening of the heart muscle. So we know hypertrophy is where cells get bigger, right? So hypertrophic cardiomyopathy. So hyper meaning too much, right? Trophy, too much muscle, okay, too much mass in the muscle. Cardiomyopathy is an excessive thickening of the heart muscle. So hypertrophic cardiomyopathy. Why would this be bad? Isn't thicker muscles, aren't they stronger?
You have less harder. When I don't say work hard, because it's thicker walls, smaller volume space.
Yeah. So hypertrophic cardiomyopathy is actually bad because the muscle doesn't get stronger when it gets thicker. It actually gets more dense, but now we have it in a smaller space. It can't expand as well as it should. And your coronary arteries they can't feed the entire muscle. The coronary arteries don't get bigger. The heart just gets bigger and it demands more oxygen. And that actually makes it work less well. It's called an enlarged heart. You're exactly right. 25, Crohn disease, CROHN. Crohn disease is a serious chronic inflammatory condition affecting the colon and the terminal portion of the small intestine. So Crohn's disease is very, very specific. Like people may have a wheat or gluten allergy as well, but it is chronic inflammation. Let me scoot us up just a bit here. There we go. All right, so let's scroll it down. Okay, let's see. So a generic term for a group of hereditary diseases of the muscular system characterized by weakness and wasting of groups of skeletal muscles, leading to increasing disability. This is 26. Anybody have a guess? Muscular dystrophy. Ding, ding, ding. Muscular dystrophy, a hereditary disease of the muscular system, weakness and wasting. All right. It just continuously gets worse, right? So 27. Ooh, y'all should know this one. Associated with an increased risk of coronary artery disease, strongly associated with an increased risk of stroke. So people who have high blood pressure have an increased risk of coronary artery disease and increased risk of stroke, right? So hypertension, high blood pressure. Anything that interferes with blank will prevent proper wound healing.
Body.
So clotting actually is the bleeding portion of it. This word is epithelialization. Epithelialization is where it forms a scab and then it heals over, right?
Epithelialization.
Yep. So epithelial scales are literally skin cells, right? The top of the skin, right? So if we can't get our skin to scab over and heal, then we can't heal at all, right? Epithelialization. Holy crap, that's a big word. All right. 29. Serum sickness results from a large single exposure to an antigen, such as a horse antibody serum. Serum sickness. So if someone says, I am allergic to horses, and something is made from horses, like the old Crofab used to be made from equine serum, right? You should not give them this, okay? Because they will literally have an anaphylactic reaction called serum sickness, all right? Well, like if you're allergic to eggs, you can't take the flu shot. There's now other options, but same thing. It will cause serum sickness. Aortic stenosis. Aortic stenosis is a condition in which the aortic valve becomes very tight and narrowed. So to stenosis means that it gets smaller, right? Very, very tight, very stiff, resulting in chest pain from decreased perfusion of the coronary arteries and or heart failure, right? So the aortic valve is what actually pushes the blood out, right? And if it can't push blood out, if it's too tight and too thick, we can't pump blood out of the heart. This can cause a lot of issues, right? Holy crap. All right. 31. Woo, we're almost there. Stress encourages the body to release fat and cholesterol into the bloodstream, which then block the arteries and eventually cause heart attack and stroke. This is telling us not to be stressed while we are in advanced EMT school. Wow. Wow. So if our stress releases fat and cholesterol into my arteries, I can have a heart attack or a stroke, in which case we will use you in class. All right. Let's do this. So this is going to be our electrolyte. Okay, so what's our symbol? This is Na, hyponatremia or hypernatremia. So what's our electrolyte? Sodium. Sodium. Yep. Sodium. Very nice. The next one is chloride, which is C, a big C, little L, and then a little minus sign because it's a negative ion. Okay.
So Cl.
And with a little minus. Yeah. Little negative. Okay. So what is this one? There's a K. K positive is potassium. Very nice. Calcium is C, big C, little a, +2. It should be a positive, isn't it? I know it's a positive ion.
+2.
+2. Phosphate is the next one. Don't even know that sign. Sorry. That one's phosphate. PHOS, PHATE. And then the next one is magnesium, which is Mg +2. Right? I know it's a positive. And then those are your normal lab values. I would recommend you know those, at least for the test. Ain't nobody gonna care afterwards. All right, let's see. Signs and symptoms of compensated, decompensated hypoperfusion. What is hypoperfusion? Shock. Okay. Agitation, anxiety, restlessness can cause what's another word for that? If we were compensating and we're doing that, what are we now becoming? If we decompensate, we're no longer agitated, anxious, or restless. What might we be? Would we be unresponsive? Yeah, totally. We would decompensate into either an altered mental status or completely unresponsive, right? So we're just no longer agitated because we're passed out. So altered mental status or unresponsive, okay? So a decompensated would be hypotension, compensated, it says sense of impending doom. Well, they say hypotension, and then the compensated portion of that is impending doom.
Oh, impending.
Yeah.
I was saying,
Oh, yeah. No, I know. I don't understand why these have to do with what they're doing, but hey, hey, I'm sure they make sense to them. All right. So weak, rapid, thready pulse. And then decompensated, it says labored or irregular breathing. That's most definitely decompensated. If your person is having labored breathing, we are going downhill fast. A weak pulse is typically already still compensating, but a thready pulse, I don't know if I agree with that. Clammy, cool, moist skin is compensating, whereas decompensated would be thready, or absent. Yeah, so that one's, wait, which one is it? Oh, I'm sorry. Clammy, cool, moist skin. Yep. Corresponds to a thready or absent peripheral pulse. Yeah, see, a thready pulse is decompensated. Thready is very weak. We can barely feel it. So pallor with cyanotic lips corresponds to ashen, mottled, or cyanotic skin. So pallor is pale, right? Cyanotic lips would be peripheral, but when we start to get ashen, mottled, or cyanotic skin, especially central cyanosis, dude, we are way decompensated at this point. This one says shortness of breath corresponds to dilated pupils. So shortness of breath is typically compensated, but if it's irregular breathing, that one's way decompensated. Nausea and vomiting corresponds to diminished urine output or oliguria. Oliguria is diminished urine output. And then, this one, impending cardiac arrest, corresponds to delayed cap refill in infants and children. So delayed cap refill is a very, very late sign in babies and children. You're fixing to die. That's it. Don't wait for that. Thirst and normal blood pressure are both blank on the decompensated. So apparently there is nothing that goes along with decompensated. Maybe it's just ultramental status. Interest. Don't know. Go for it.
In the book, I didn't realize, I thought I was still mute. In the book, it says for decompensated, for the normal blood pressure, it says hypotension.
Yes, hypotension. And it's on there, the decompensated hypotension. And the corresponding one to that one was sense of impending doom. Yeah. So if they're like, oh, something's fixing to happen, then they start to decompensate, their blood pressure drops. Okay. Less than 100. Yeah, I don't know. These are definitely just signs and symptoms, but I don't think that they actually go with each other. I think it's just random lists on both sides. Ooh, respiratory diseases. These you will see forever, right? Forever. Okay. So emphysema, it says, causes a breakdown of alveoli. So a breakdown of alveoli and shortness of breath. So this is also air trapping. The breakdown of alveoli, the alveoli are supposed to be, one size, and the air trapping causes them to get bigger and bigger, which causes them to stiffen, and they can't exchange gases. It's very specific. Chronic bronchitis causes a cough and shortness of breath. All these are shortness of breath, you think? The third one down is inflammation of the bronchi, which is acute bronchitis. Why do we know it's acute? Look at this. Viruses and bacteria. That's acute, right? Viruses and bacteria cannot be chronic. They only have a short lifespan, right? Scroll it up. It's a radio. Ugh. Sinusitis, inflammation of the sinuses. And if we're going to the blanks, it is viruses and bacteria and poor general health. So viruses and bacteria plus poor general health can cause inflammation of the sinuses. Ooh, this one you guys should know. Inflammation of the larynx and vocal cords, sore throat, hoarseness, mucus buildup, cough. So if my larynx is inflamed, laryngitis. I know, right? Inflammation of the larynx. I once had a bad case of laryngitis. It still worked, but my partner had to give all my radio reports. It was terrible. Everybody at work loved it because I couldn't talk for like a week. It was not great. All right. So pneumonia, inflammation of the lungs can be caused by bacteria, virus, fungi, irritating gases, and lack of physical activity. So bacteria, viruses, fungi, irritating gases, and lack of physical activity. So the lack of physical activity is very specific to people that are stationary. That's why you breathe deep. You make sure you're doing your exercises, breathe into one of those little ball thingies, right? So that you keep your lungs filled with air so that they don't get stagnant and start to fill with fluid. But you can also have bacterial pneumonia, viral pneumonia, fungal pneumonia, irritating gases. It can also be aspiration pneumonia. So that irritation of from stomach contents, all kinds of stuff, right? Asthma. So this one is constriction of bronchioles. We know it's bronchioles, right? It's upper, but it's also lower, right? Mucous membrane. Wow. Mucus buildup in the bronchioles, wheezing, and difficulty breathing. The probable genetic link is much discussed lately. Ooh, critical thinking, my favorite kind, right? Okay. Respiratory acidosis. We have a ton, and I'm going to send you guys all of these as well. Okay. I think I already emailed it to everybody, but I'll email it to John as well. So any 5 of the following, we could have airway obstruction, cardiac arrest, CNS depressant, submersion, respiratory arrest, pulmonary edema, closed head injury, chest trauma, all of it, right? What about metabolic acidosis? Tell me one thing that does not cause metabolic acidosis. Breathing. I know, right? Yeah. Nothing to do with respiratory. So we know if it's metabolic, it's going to only be kidneys, okay? Lactic acidosis, ketoacidosis, aspirin overdose, alcohol ingestion, GI losses, carbon monoxide poisoning. And it's carbon monoxide poisoning on the cellular level, okay? Not the respiratory version, okay? List 5 processes that cause cellular injury. All right, we can do this one. Hypoxia, ischemia, chemical injury, infectious injury, immunologic, physical damage, and inflammatory. Yeah, all of those cause problems with the cells, right? Plasma protein systems and their response, complement, coagulation, kinine. Oh my gosh, man, I haven't seen these words in years. Oh my goodness gracious. Number 5, the 5 stages. Oh, general adaptation syndrome. Yeah, this is alarm, resistance, and exhaustion. So alarm is like the inflammation part that's like, whoa, something bad just happened, right? Resistance is my body's reaction to it. And then exhaustion is when I'm done. I've lost all of my response, right? I can't fight it anymore. It starts to decompensate. Let's see. Helper T cells. This is all the macrophage. It's talking about binding with phagocytosis, where it actually eats the cells, right? Subgroup of T cells. Oh my gosh, man, we're going to skip all of those. All right, and then there's an ambulance call that gives you a narrative as well, right? So we're not gonna work on that one this time, okay? So let me clear my. We lost a couple of people. They probably got scared. All right. They're like, oh my gosh, this is too much information, right? So I don't know how long we've been recording, but we had it set for about an hour and a half, and I think we're just like right about there. Okay. So questions that I can answer. That's good, because I probably couldn't answer the question anyway. Just know, guys, this is very, very much for the test. Okay. We are not going to be dealing with phagocytosis. We're not going to be really related to leukocytosis. We don't care about any of these things. Okay. So we do care about the pathophysiology of the cellular response, because we need to know how the medications work. And if my patient is taking a med and I'm giving a different med, are they going to interact together, right? So I need to know the disease processes of asthma. I need to know that it's a lower airway, right? Lower airway is wheezing, right? Upper airway is stridor. So this is very specific. I need to know why the swelling is happening. I need to know why epi works for anaphylaxis, and why, epi works also for septic shock, right? Or norepi. So all of these things are important. Memorize it for the test, get through it, and then start acting with it. It helps to know the medications. It helps to know the physiology. But my gosh, guys, some of these are words I have not seen since paramedic school or when teaching paramedic school. And I did not even know they were included in your advanced EMT book. So clearly we have come a long way with advanced EMTs. Okay. But the biggest thing I would do, I'll put up some more stuff on our YouTube channel as well. We are exhausting my Google Drive, but I will give you guys more of the Google Drive. I'll post this on the Google Drive as well for those that didn't get it in the email. You can absolutely work through the workbook, look up what you don't know. Okay, Google doesn't always know everything, right? But absolutely look up some of the things that I was like, oh yeah, that word sounds familiar. I'm pretty sure I learned it like 100 years ago.
Jim,
So we have one, and I'll post the videos that we're posting on our Google Drive. I'll put it on our YouTube channel as well. But there's a ton of different YouTube channels that you can just type in. Yeah, but I'll send it out.
The mountain medics or
I don't remember the name of my YouTube channel, to be honest, but I will look it up. I'm pretty sure it's just PVCPR. I never use it. I just use my Google Drive, right? But we're exhausting the limits of the Google Drive. So, but I'll add a link in the Google Drive to the YouTube channel for anything that you don't have there. Okay. So we're going to end the recording. I will post it and I'll send it out by email, the link to the post. Okay. And if you have any questions, definitely email or text me. All right.
Thanks, Captain. Bye.